the first ripple was the spark of funding, the second ripple was about connection, bridging vision with action.
I've been working with the department for 11 years in supporting rural health and rural communities. And my role really in the Rural Vaccine Equity Initiative was the kind of high-level program oversight and really starting at the table from day one when we were notified both through our national partners as well as internally here at the department that there was a rural carve-out that was going to be happening with some CDC funds.
When it came time to decide how those dollars would be used, the question was clear. Who could carry this work in each rural community?
We saw a lot of investment and support coming into a number of kind of different agencies across the state. But really what was missing, ideally for our rural communities, was the key kind of conveners on the ground. We spend a lot of time assuming that small community-based organizations and small community-facing groups and networks should be supporting the work that's happening at the state, federally, et cetera, without actually paying them for their expertise and knowledge of community and support at the end of the day. And so we really wanted to operationalize and use these funds in a way to help support that capacity on the ground for community, build that capacity on the ground for community, and at the end of the day, really help to shore up these networks and infrastructure that have lived for a long time in our rural communities in a way that was going to allow them to help us both facilitate the vaccine equity work while also create a space for shared learning across the state.
What happened next was unprecedented. Not competition, but collaboration.
I'm happy to say that across all of the applications, we did not have a single area that came in with multiple applications. So if we look at our rural clusters that we have across the state, there was one applicant for each space that included an endorsed application from all of their community partners saying, hey, we sat down in community, we talked about this, we looked at who was going to be best to hold this. And for every community, those were different types of organizations.
But funding alone wasn't enough. Someone needed to bridge state government and community partners. And that's where the New England Rural Health Association came in.
Contracting and being within state government is often just a barrier for folks to engage. We're very heavy on administrative processes and requirements that often small rural organizations don't have the capacity to manage. And we knew that the New England Rural Health Association, one, could help manage these funds in a way that was going to be more flexible and provide that kind of administrative and operational support, as well as being able to be an external to state government technical assistance partner. We're talking about community partners, we're talking about government as a partner, and then we're talking about this regional organization that was really able to hold some of the subject matter and content expertise that was needed to bridge those gaps between our internal partners, our external partners, and make all the work come together.
The results were powerful. When CBOs were trusted with resources, their reach multiplied far beyond what state government alone could do.
Our network at the end of the day ended up with over 1,000 engaged partners. Us as the State Office of Rural Health alone, we do not have the capacity to be engaging that many folks at the end of the day. But by funding these community partners who held these large networks, we're able to really engage and operationalize these networks to be an active part of this, right? And so it became these extended arms where we were really both sharing power, sharing folks' ability to step into this work, and to come alongside and partner with them, right? We only gave $75,000 a year to each one of these CBOs, but what we ended up seeing was that investment grow, right? And we watched those dollars multiply in community. We watched projects stand up and multiply in community, from food access to healthier walking paths to you name it across the board. It was beyond our wildest dreams, right? We were hoping that by holding partnership in community, by helping share power and agency, by planting some seeds, that we would allow communities to make some small progress in a number of areas that we know our rural communities have been struggling with for decades. And what we saw was just like a lightning shift. Like, it was just unbelievable in the way that our community is not only organized around these different topic areas and being able to move these community projects forward, but watching things actually be actualized and implemented through these additional investments across the board.
This is what happens when you bridge vision and action. One ripple becomes many. This is the rural effect.